When it comes to oral health, the earlier you start, the better. And implementing healthy habits at a young age can translate to healthy gums and teeth when you are an adult. Dr. Andrew Hagan is here with the answers to some very common questions regarding pediatric oral health. Thanks so much for being here, Doctor.
Thanks for having us.
We
appreciate
appreciate it. So first of all, let's just start off. A lot of people want to know, when is the right time to bring their child to come see a dentist?
So we recommend actually shortly after the child's first tooth comes in, or at least by their first year of age, it's a good time to get the kid into the dentist's office. That just kind of allows us to do a couple of things. It's a very quick and easy exam. We make the child as comfortable as possible because they're young at that point.
Right.
So we understand that. We let the child kind of lay in their parent's lap. We do exams, just check for growth, development, make sure everything is good. And really, you kind of get that routine, get them used to being at the dentist's office and comfortable and everything. And actually, the most important part of that process is to let the parents know what to look for as the kids grow and get more teeth, and how to take care of them so we can hopefully prevent some of those dental issues from popping up.
Right, and you said taking care of the child and being able to brush the teeth.
Exactly.
How do you brush a child's teeth?
It can be challenging, and I know I've got a 1.5-year-old child at home, so I know that can be challenging. But we recommend, get a soft bristle toothbrush. We recommend twice a day to brush their teeth. In the morning, like after breakfast or right before bedtime, is a good time to do that. And like the little guys less than 3 years old just need a tiny little smear, like about the size of a grain of rice is all you need to brush their teeth with. Make it fun is the main thing. I know it's hard with the little guys.
Right?
Exactly. Make it fun for them as much as they can. Smile. Play games, make funny faces.
Right. And there's a different kind of methods based on how old the child is, right, and how many teeth they have.
Yeah, exactly. So when the child gets older, you can use a little bit more toothpaste. About 3 to 6 years old, we recommend like a pea-size amount of toothpaste to do that. And then it becomes a challenge. I have a 6-year-old at home too, so he wants to do everything as himself, which is awesome. We want to encourage that, but kids, you have to keep in mind, they don't have the dexterity and the skills to kind of brush thoroughly.
Right.
So we tell our patients at our practice that if they can tie their shoes effectively and do that regularly, that they can usually brush their teeth on their own.
That's a good rule of thumb. I like that. And so a lot of parents too, kids, they like to go out and have fun. Sometimes accidents happen where they maybe chip a tooth or something.
That happens more common than we like. We get a few of those phone calls every year. So, what you want to do after you've probably finished freaking out, you want to if there's any little tooth pieces or pieces that, if you find a whole tooth comes out, save those pieces. Put them in like a little Ziploc or a little plastic container. Cover them with milk, actually, is what we recommend. Or if you don't have that available, clean water is fine as well. And then call the dentist's office. And our particular office, we always make sure that someone's available for those type of things to answer questions.
Great, even when you're closed.
Exactly, and it's helpful with today's technology with the cell phone. They can usually send us a picture, and hopefully we can just reassure them that it's nothing, but if it's a serious thing, we'll get in very quickly and help the child out.
Of course, and like you said, try to calm down the parents, right? I'm sure those are
that's half the battle.
Exactly. And so another thing too that a lot of people maybe get confused about is, do they need to see a pediatric dentist for their child?
Yeah, there is some confusion about that out there. So just to kind of clarify, all dentists as part of the dental school curriculum are trained on dental care for kids and how to look for growth and development and all that sort of thing. So at our own practice, we love to see kids. We enjoy it. We enjoy seeing families. Kids that, we like to see the kids kind of grow. It kind of makes me feel old to see the guys that we see this at tall and now they're graduating high school and that sort of thing. So pediatric dentists receive additional training beyond dental school, and it kind of focuses on like special needs children or children that have severe dental problems, or kids that need to be put to sleep. So, the main thing is, make sure that your kids are getting regular dental care. And again, we find in today's day and age that with parents and families as busy as they are, it's convenient for our families to come to one place and one time and just get all their dental care taken care of.
And of course, find someone that the whole family feels comfortable with too. Well, Dr. Hagen, thank you so much for joining us.
Yeah,
we always appreciate some great tips that I think a lot of parents are going to find very useful. Make sure you check out kingsportdentist.com for more information. And Dr. Hagen, your dentistry practice is in Kingsport. Yes. You can go ahead and call them today if you have any more questions. Thanks so much for being here.
Thank you for having me. I appreciate it. Yeah.
Of course. And